When I say we could cut the cost of healthcare in the United States by 50% and drive up quality at the same time, there's no reason to doubt it. How do we get there from here? Do we order the docs, do it this way? Do we have a standardized system, everybody's got to do it the same way? Well, there's several things wrong with that. One is, that doesn't sound very much like doctors. The second one is, it's not very American. We don't do things that way. But the third thing is, we don't know what it is that they're doing different in Minnesota. We don't have the data yet to figure out what's different. So how do we get there from here? It's not by some kind of huge government fiat. It's by a very simple thing. We have this belief in America, which I've mentioned several times. It's probably the most widely shared belief in America, which is you get what you pay for. Well, in order to feel like you're getting what you pay for, you have to know what you're getting, and you have to know what you're paying. And on both ends, in healthcare, we have no idea. Am I getting what's really the best of it? If I crunch my fender and I take it to a auto body place, the auto body place, they put up on the rack, they look and see if the frame's bent, they do a little estimate, and they hand me the estimate. At least in California and in many states, that estimate's binding. When I come back, the fender will be all fixed, and that estimate will be my price. They don't put on extra charges for extra Bondo, or because they had to wipe their hands twice, or anything like this, or calling in a specialist for a new kind of paint. They made an estimate, I come in, the thing is start to finish, it's all done. If I drive away from it and the headlight doesn't work, what do? I drive back and say the headlight doesn't work. They go, oh, they fix it. Do they charge me extra for that? No, they don't. If I take my knee, I brought my knee along. It's my favorite prop. If I ever get it fixed, I don't know what I'll do. This is as much as it bends right there. And it hurts a lot. And I got a lot of poor knee. Can I have some sympathy? Oh, okay. Now, I take my knee to healthcare. And what do they say? They say, well, there's this, there's that. You could have a new knee put in. You could have a new operation. All these choices. Do I know which is best? I don't know. Well, suppose my doctor says, I think we could clean up that old operation. Why don't you take this over to Dr. McGillicuddy? He's good. Not only do I not know if Dr. McGillicuddy's any good, my doctor doesn't. Dr. McGillicuddy doesn't know if he's any good because they don't measure these things. Here's the rule of thumb. All doctors are above average. Right? It's like Lake Wobegon or something. All doctors are above average. Let's imagine a future when I take my knee to my doctor and I say, can we fix this? I've done enough speaking this year. I don't need this prop anymore. Let's fix this thing. And he says, okay, let's find out who's really good at evaluating and fixing knees. And we go on the web and we find out who has the best scores. I don't know how you'd score this. Maybe range of motion, reduction in reported pain, and be able to say, here are the clinical outcomes for these programs. And by the way, it's not a knee surgeon. It's a fix your knee program. Everything from diagnosis all the way through to rehab. All in one package, one price. Here's what they cost. Here is their clinical rating score. And here's their patient satisfaction score. It's all out there on the web. And it's all rated by some third party. It's not their doing. We can find out you get what you pay for. So what's changed in that image from the old days to the new days? It's not some government fiat. It's very simple. It is very simple. Competition and data transparency. We did not used to be able to ask the question. If you choose a sandwich, if you go to Starbucks, if you buy a car, if you order a Christmas present, you're asking a value question. You're asking, how good is it and how much does it cost? That's the value question. It's what they call cost-benefit analysis. We do it all the time. Until now, we have not been able to ask that question of healthcare. With the new data universe we're in, all of a sudden we can ask the question. And all sorts of things begin to change.